There's nothing quite like collapsing on the couch after an impossible day and having your cat climb straight into your lap, headbutt your chin, and lick the back of your hand like you are the only good thing that happened today. For most of us, that rough little tongue is one of the purest signs of love we will ever receive. But what if I told you that is not always what is happening? What if your cat pins your wrist down and licks the exact same spot for 10 minutes straight? What if they are not licking you at all anymore, but sucking and chewing on your sweater, your blanket, or the corner of your bathrobe, over and over, like they cannot stop themselves? If you saw the thumbnail of this video, you already have a feeling something is wrong. And you are right to feel that way, because as a vet, I need to tell you the truth. Sometimes that lick is not affection. Sometimes it is your cat quietly begging you for help. What if I told you that your cat's tongue is actually one of the most honest messengers in your entire house? What if I told you that a burning stomach, a wave of nausea, and a mind spinning with anxiety can all show up as the exact same simple behavior, licking? And what if I told you that you do not need a single, expensive test to start noticing the difference? You just need to know what you are looking at. Let me guess. You are probably thinking, come on, Dr. Lucas. It's just a cat being a cat. Well, my friends, I have some important news for you. And once you hear it, you will never look at your cat's tongue the same way again. Hi, everyone. I'm Dr. Lucas Aoki, your neighborhood cat vet, and welcome back to the channel. In my clinic, one of the most misunderstood cries for help I see every single week is a cat who will not stop licking, sucking, or chewing on something that is not food. And here is the statistic that should stop you in your tracks. Chronic digestive disease is one of the leading reasons middle-aged and senior cats end up in my exam room. And in a huge number of those cases, the very first symptom the owner ever noticed was not vomiting. It was licking. I know some of you are sitting there right now feeling a wave of guilt, thinking, I thought it was cute. I even filmed it. My friends, please hear me. You are not a bad cat parent. Cats hide pain on purpose. It is written into their biology as a survival instinct from their wild ancestors, and licking is often the loudest signal they know how to send. Ignore it long enough, and depending on the cause, you could be looking at anything from a chronically inflamed gut to a swallowed piece of fabric sitting in your cat's intestines right now. Today we are doing a complete masterclass on your cat's tongue and what it is really telling you. Grab a pen and a notebook if you want. We are going to learn the real difference between a loving lick and a medical one. We will uncover the truth about the silent stomach pain hiding behind it. We will talk about the anxious mind behind compulsive sucking and chewing. I'm going to give you a vet warning that could genuinely save your cat's life, and then I will hand you the exact at-home plan I give my own clients. Hit that subscribe button so you can join our community of educated cat parents, and let's get into it. Let's start with Chapter 1, the difference between a loving lick and a warning sign. To understand when licking becomes a problem, we first need to understand why cats lick at all. When your cat was a newborn kitten, their mother licked them to clean them, to stimulate their breathing, and even to help them go to the bathroom. That instinct never disappears. It gets folded into adult life as something we call social grooming, and it is one of the strongest bonding behaviors a cat has. When your cat licks your hand or headbutts you first and then gives your cheek a few slow licks, they're treating you exactly like a member of their own colony. On top of that, cats genuinely love the salty taste of human skin, especially after you have been sweating or crying. So a few gentle licks here and there, that is affection, plain and simple. But the warning sign looks completely different, and I want you to picture it clearly. Your cat is curled up next to you on the couch. Suddenly they start sucking on the corner of a wool blanket or the cuff of your sweater, rhythmically, almost like nursing. Their eyes glaze over. If you gently pull the fabric away, they follow it right back and start again within seconds. Some cats skip the fabric completely and lick the same 6 inches of carpet. Or worse, they start licking at the air itself, swallowing hard again and again. An owner in my clinic once told me, Dr. Lucas, she has been sucking on my cardigan for 20 minutes and she will not stop. I actually timed it. Please hear this vet warning. Let me clear this up with complete certainty. Quirky cats absolutely exist, but a stuck, repetitive loop like this one is never just personality. Veterinarians call this compulsive licking, and it is a genuine medical signal. This brings us to Chapter 2, the silent stomach ache underneath it all. When a person feels nauseous, we reach for a mint or an antacid. Cats obviously cannot do that. Instead, when a cat's stomach is burning or unsettled, their body pushes them to swallow more often, and swallowing needs saliva. The fastest way for a cat to produce a flood of saliva is to lick something, anything, repeatedly. This is actually one of the recognized signs veterinarians look for when we are scoring nausea in a cat, along with lip smacking and drooling. If your cat is licking the air, licking your arm frantically, or gulping right before or after meals, their stomach may genuinely be in distress. In a lot of these cases, we eventually land on a diagnosis of feline inflammatory bowel disease, one of the most common reasons middle-aged and senior cats end up with chronic vomiting, soft stool, or unexplained weight loss. Inside your cat's intestine, there is a lining built from cells packed together like tiles, controlling exactly what is allowed to pass into the bloodstream. When that lining is chronically inflamed, from food sensitivities, parasites, or long-term stress, those tiles can loosen, and irritating bacteria and undigested particles start slipping through where they should not be. The gut sends up a flare of inflammation, the stomach feels raw, and the cat's only tool to cope with that raw feeling is licking. Please hear this vet warning. If this is happening around meal times, or it is waking your cat up at 3 in the morning, this is a conversation for your vet, not something to laugh off in a comments section. Now to Chapter 3, the anxious mind behind the lick. Let's say your vet runs full blood work, examines the belly, and your cat is completely clear. So why are they still sucking on your sweater sleeve for 20 minutes with that same glazed look? My friends, licking does not just soothe an upset stomach, it soothes an anxious mind. When a cat licks or sucks on something repetitively, their brain releases a wave of endorphins and dopamine, the same feel-good chemicals we chase when we bite our nails or scroll our phones without thinking. If your cat is dealing with a stressful multi-cat household, a recent move, a new baby, or even just chronic boredom from being understimulated, they may lean on sucking or licking as their only coping tool. This is especially common in certain breeds like Siamese, Burman, and other Oriental cats, and researchers believe it is often linked to being weaned from their mother too early. But Dr. Lucas, what if my cat has done this since they were a tiny kitten? Does that mean it is not medical? Great question, and the honest answer is, it can still escalate. Even a lifelong habit can tip over from harmless comfort into a true compulsion under enough stress. Picture what is happening in their mind in that moment. Their brain is essentially telling them, this feeling is too much, I need something to make it stop. Right now. This is a real veterinary warning, because a compulsion that started as comfort can become dangerous when a cat gets so fixated they stop eating, stop using the litter box, or start swallowing pieces of what they are chewing. And I want to be honest with you here. Stress in cats is never just emotional, it is medical. The same chronic stress that drives compulsive licking is the same stress hormone surge that can trigger painful bladder inflammation, and in male cats specifically. A blocked bladder is a same-night emergency, not a wait-and-see situation. We cannot treat the sucking without also treating the fear underneath it. Before we get to solutions, I need to pause this masterclass for Chapter 4, because this is the chapter that could save your cat's life. Never ever let your cat lick your skin if you use certain topical medications. And honestly, my friends, cats are not small dogs here. If anything, they are more vulnerable, because a cat's liver struggles to break down chemicals that a human, or even a dog, can process just fine. In my emergency clinic days, I saw this heartbreaking scenario more than once. A client applies a prescription arthritis gel like diclofenac to a sore knee before bed, climbs under the covers, and their cat curls up and licks the area out of pure affection. Within a day, that cat is vomiting blood from stomach ulcers and needs emergency hospitalization. If you use a psoriasis cream containing calcipotriene, even a small lick can send your cat's blood calcium level spiking, which can shut down their kidneys within days. If you use a topical estrogen or testosterone replacement cream, repeated licking can cause hormonal imbalances and bone marrow suppression over the time. And please, never use a muscle rub containing essential oils like wintergreen or menthol anywhere your cat can reach with their tongue, because a cat's body cannot safely break those down either. I am not telling you this to frighten you. I am telling you this to empower you. If you use any medicated cream or ointment, cover the area with clothing or a bandage immediately, and keep your cat away from that spot until it has fully absorbed. Please hear this vet warning. Loving your cat like family is beautiful, but human medicine and feline biology do not mix. All right, let's move to Chapter 5 and talk about what you can actually do. Tip number 1, do not punish the behavior. If your cat is sucking on your sweater or licking the same spot on the carpet, please do not yell. Do not spray them with water, and do not yank the fabric away aggressively. Remember what we just learned. They are either physically uncomfortable, genuinely nauseous, or riding out a wave of anxiety, and punishing a scared, nauseous cat only teaches them to hide the behavior from you, not to stop needing it. Tip number 2, redirect the licking somewhere safe. Since we know this releases calming dopamine, let's use that on purpose. Take a lick mat, they cost only a few dollars, and smear about 1 teaspoon of a plain, cat-safe pureed treat across it, the kind sold in little squeeze tubes with no onion or garlic in the ingredients. Freeze it for 20 minutes before you give it to them. It gives your cat that same soothing dopamine release, keeps their brain busy for 10 to 15 minutes, and protects your sweaters at the same time. Tip number 3, soothe the gut from the inside. If you suspect this is coming from a sensitive stomach, add a feline-specific probiotic to 1 meal a day, following the dose on the label for their body weight. You can also offer 1 tablespoon of plain, unsalted, onion-free, and garlic-free cat-safe bone broth over their food. And because so much of feline digestive and kidney health comes down to hydration, this is a perfect moment to start transitioning your cat toward more wet food, since a cat's body was never built with a strong thirst drive to begin with. And a well-hydrated gut is simply a calmer gut. Tip number 4, know when this needs your vet, not your kitchen. If your cat sucks on a blanket once in a while when they are sleepy, that is normal, harmless comfort behavior. But if it is happening daily, if you ever find torn or missing pieces of fabric, or if it comes with vomiting, diarrhea, or your cat going without food for over 24 hours, stop trying to manage this at home. A swallowed piece of fabric can lodge in the intestine and become a surgical emergency, and a cat who stops eating for even a day or two can develop a dangerous liver condition. That is your cat begging you for professional help, and that phone call could save their life. Before we finish, let's bring this all together, because I know that was a lot. We talked about the difference between a loving lick and a compulsive one, the silent stomach pain that can hide behind it, the anxious mind that sometimes takes over, and the real danger of letting your cat lick certain medications off your skin. I promise you, you do not need to memorize all of this today. Here is the golden rule. Pick just one thing to watch this week. Is it happening daily? Is it fabric instead of skin? Start there, and everything else will fall into place. Our cats speak an incredibly rich language, they just never learn to use words. Every slow blink, every headbutt, and yes, every strange little lick is a sentence they are trying to say to you. The fact that you took the time to sit through this whole masterclass instead of scrolling past tells me everything I need to know. Your cat has an absolutely wonderful cat parent. If this masterclass helped you understand your cat a little better, please hit that like button. It helps tell the algorithm that safe veterinary advice is worth spreading, and it helps this channel protect so many more cats. Hit subscribe so you never miss our deep dives into your cat's health. And I would genuinely love to hear from you in the comments. Has your cat ever had one of these sucking or licking sessions? And did you know what it meant before today? I try to read every single comment. I'm Dr. Lucas Aoki. Thank you for loving your cat enough to protect them, and I'll see you in the next video.